Hello. So I'll talk about intra-aortic balloon pump counterpulsation, which is a mechanically circulatory assist device which is inserted in number of indicated conditions like cardiogenic shock or refractory angina or angina not responding to maximal medical therapy. So we will talk about the technical aspects of the device, how do we insert the device, what are the parts of the device, what could be the complications associated with the device. Then we will talk about what circulatory support does the device offers. So how does it assist in the cardiovascular system? How does it assist the failing heart? We'll also talk about that how do we inflate and deflate the device for gaining the maximum benefit from this balloon pump counterpulsation. So let us start our discussion with what exactly is the device. As I already said, it is a circulatory mechanical assist device which is inserted for a quick support to the failing heart in number of different clinical scenarios. It is a temporary circulatory support device. So intra-aortic balloon pump, which I will write now as IABP, is a mechanical circulatory support device. It is a mechanical circulatory support device, right? It's a mechanical circulatory support device. And what does it do? It is used to provide quick support to the circulation to the failing heart during number of different clinical scenarios like cardiogenic shock. So it is used to provide the circulatory support, provide quick circulatory support in different clinical condition, in different clinical scenarios like your cardiogenic shock, your refractory angina, as I just mentioned. So coming on the technical aspect of the device, now what is device? What are the parts of the device? The device, the technical aspect, the technology aspects. So technology aspect of the device. The device has two parts. It has two parts, two principal parts basically. The first is a flexible catheter which has two lumen. One lumen is used for aspiration or push of the fluids or for pressure monitoring. So one is for pressure monitoring, and the other lumen, which is the main lumen, is for giving the helium gas, for using helium gas to inflate and deflate the balloon attached to that lumen. And that would be the principle on which this device will, that would be the thing on which this device will work. The inflation and deflation of the balloon attached to the port of the intra-aortic balloon pump. So the first part is a flexible catheter. It's a flexible catheter. Okay. Now this flexible catheter, as I said, it has two lumens. So one lumen, the first lumen, one lumen is used for aspiration and flushing. It is used for aspiration or flushing, or it is used for pressure monitoring. So this allows aspiration, flushing or pressure monitoring, which number of times we do for the device. And the second lumen, which is the main lumen, the second lumen. Now this lumen permits the periodic delivery and removal of helium gas in a balloon which is attached to it. So this allows periodic delivery and removal of helium gas to a closed balloon, which is attached to the lumen. Now this balloon, it has capacity of the volume of 20 to 50 cc. Okay. Now the inflation and deflation of this balloon acts as a circulatory assist. How does it act? We will talk about it. So this is the first part of the IABP machine. Now let us talk, how do we insert this flexible catheter? Now this flexible catheter, how do we insert it? So how is the catheter inserted? Catheter inserted. Now catheter is inserted through common femoral artery. So as I said, in most cases, thus it is inserted from common femoral artery, and we insert it under fluoroscopic guidance, because the distal end of the catheter has to be placed in proximal descending aorta, just 1 centimeter distal to the origin of left subclavian artery. So common femoral artery, under fluoroscopic guidance, the catheter is inserted into proximal, the distal end of the catheter is in proximal descending aorta, about 1 centimeter distal to the origin of left subclavian artery. 1 centimeter distal to origin of left subclavian artery, right? Left subclavian artery. Okay. So here the end of the catheter or the balloon is placed, okay, in proximal descending aorta. So this could be one important thing that we need to keep in mind. Okay. Now, so this is the first part of the machine. Now coming on the second part of the machine. The second part is a console, which is used for inflation and deflation of the balloon, and this inflation and deflation of the balloon is timed with the help of the aortic pressure graph tracing and EKG of the machine, So the second part of the device is a console. Now this console is used for the inflation and deflation of the balloon. So pumping is initiated and controlled by console using input from aortic pressure and the ECG of the patient, using input from both the aortic pressure tracing of the patient and ECG of the patient, right? So these are the two tracing which provides the input. And remember, the inflation of the balloon is done when the aortic valve closure happens, and deflation of the balloon is just before the aortic valve opening, right? So inflation occurs after aortic valve closure, So this is important. Inflation is occurring after aortic valve closure, and deflation occurs before aortic valve opening, So if I show you the tracing of the aortic pressure graph and the EKG, we can see whether the inflation and deflation is happening at the correct time or not. So just showing you the graph. So you can see in this, let's say, this graph, how is inflation and deflation being controlled. So you can see that inflation, I said, has to occur after aortic valve closure. So aortic valve closure in aortic pressure tracing would be corresponding to the dacrotic notch. So remember, the timing of balloon inflation is adjusted until it occurs late in diastole, uncovering the dicrotic notch. So just uncovering the dicrotic notch. So timing of balloon inflation, right, is adjusted to occur late in diastole, right? Just uncovering the dicrotic notch, late in diastole, just uncovering dicrotic notch, okay? And your deflation, the timing of deflation is timed in such a way that it happens when diastolic dip, unassisted diastolic dip is 10 to 15 mm of Hg for maximum benefit. So, timing of deflation is adjusted to occur at end of diastolic dip of 10 to 15 mm below unassisted diastolic pressure, right? So it is just when the diastolic dip, normal unassisted diastolic dip is 10 to 15 mm, right, mm of Hg. At that point, the deflation happens for giving the maximum benefit, right? Maximum benefit in increasing the systolic pressure let's say affecting the systolic pressure of the patient, right? So systolic pressure would be maximally affected when we time the deflation at the diastolic dip of 10 to 15 mm of Hg, right? So timing is very important. What would be the hemodynamic benefit which this inflation and deflation will offer? So as I said, inflation occurs during after the closure of the aortic valve. That is, it is occurring late in diastole after the closure of the aortic valve. So what this offers to us? Two main benefit actually. So two main benefit of inflation and deflation of the balloon happens. So two main benefit, okay? The first benefit is that number one, the blood is displaced in the proximal aorta by inflation during the diastole, and this displacement of the blood in the proximal aorta would improve the coronary perfusion. So blood is displaced to proximal aorta by inflation during diastole, right? Now second benefit is the aortic, what happens during deflation, the aortic volume is reduced. So aortic volume is reduced during deflation. So during systole, reduced during systole through vacuum effect created by the deflation. Through vacuum effect created by rapid balloon deflation. So the aortic volume is decreased. So aortic volume is decreased by this rapid vacuum effect. So this will effect in decreasing the systolic blood pressure of the patient. And blood is displaced in the proximal aorta during inflation. This will augment the diastolic pressure and improve the coronary perfusion. So that's why its role in the refractory angina and cardiogenic shock has been seen. So now these two main benefits depends upon few important factors. It depends upon the volume of balloon, what is the volume of balloon, how much helium gases has been used to inflate it, then position of the balloon in aorta, then it also depends upon the heart rate and rhythm of the heart, and depends upon the compliance of the and systemic resistance. So this maximum benefits depends upon the volume of balloon, position of balloon in aorta. It also depends upon heart rate and rhythm, and compliance and systemic resistance. So it depends upon all these things, these two maximum benefits. So inflation augments diastolic pressure, deflation decreases systolic pressure. These are the two important benefits that we have to remember. Inflation augments diastolic pressure by displacing the blood in proximal aorta. So proximal aorta, the blood is displaced, coronary perfusion etc. increases, diastolic pressure increases. And due to vacuum effect created by sudden deflation, right, during systole, the systolic blood pressure of the patient will decrease. Okay. Now, so because of these two main benefits, what is the effect on hemodynamic? So first effect on the hemodynamic is it can decrease the systolic pressure by 20%. So decreases systolic blood pressure by 20%, increases aortic diastolic pressure, the diastolic pressure by 30%. So increases aortic diastolic pressure by 30%, and this will definitely improve the coronary blood flow, right? This will improve the coronary blood flow. And since augmentation of diastole is happening, the mean arterial pressure would also increase. So mean arterial pressure. So augmentation of diastole is happening more than what it is decreasing the systolic pressure. The main effect is the augmentation of the diastolic pressure to improve the coronary blood flow. So mean arterial pressure is increasing, so it's beneficial in cardiogenic shock. So mean arterial pressure is increased in patient in shock, right, due to the mechanical abnormality like mitral regurgitation or VST, especially, right, in shock, especially due to mechanical abnormality like mitral regurgitation or ventricular, let's say ventricular septal defect, etc. Now, fourth is decrease in heart rate. So it also causes decrease in heart rate by 20%. And it causes decrease in pulmonary capillary wedge pressure by 20%. So decrease in pulmonary capillary wedge pressure by 20%. So augmentation of cardiac output is seen by 20%. So increase in cardiac output by 20%, especially seen in patient with mechanical complications like your let's say your mitral regurgitation and ventricular septal defect. Okay, so cardiac output is also augmented. Then it decreases mean systemic impedance, right, and develop, let's say 14% decline in left ventricular wall stress, right? So this 14% decline in left ventricular wall stress plus decrease in heart rate would decrease myocardial oxygen demand. So this all will decrease myocardial oxygen demand, right? Now one of the main benefit of the device is to augment the coronary perfusion, is to displace the blood in proximal aorta and improve the coronary perfusion. And number of studies has been done to see its effect on the coronary perfusion, and the report is variable from no effect to a maximal effect. So remember that in various study, effect on coronary blood flow in various study has shown to be variable, right? So no effect to significant augmentation, but its main USP is that it is improving the coronary blood flow. Remember this, right? So improving the coronary blood flow offers a very much benefit in myocardial ischemia, in augmenting of cardiac output. It offers a maximum benefit in your cardiogenic shock, especially due to mechanical problems. So these are the systemic benefit of the intra-aortic balloon pump. So if you see this, let's say graph, how the intra-aortic balloon pump, when it is applied, it is offering the benefit. As we can see that the augmentation of the various pressures are happening, and it is coinciding with the ECG, and augmentation